you do want to make sure that that odor isn't linked to something else going on in that area that needs to be treated directly. Is there an infection in the vaginal skin? Is there actually infection internally, more like a yeast infection or a sexually transmitted disease we don't look at? Of course, you eliminate that.
Hi, Skin Friend. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I'm really excited to have a fellow board-certified dermatologist, Dr. Shannon Trotter, on with me. She is also a new podcast host, so be sure to check out her podcast, Derm Trotter, as well. And I'm going to include all her info in the show notes. But today, we're going to be talking about things that are kind of embarrassing to talk about. Things that you maybe are going to be a little hesitant or reluctant to bring up with your dermatologist, but that is why we are here. We're the experts in skin health. And so if you've got a skin concern, we definitely want to know about it, even when it's embarrassing. So maybe you've noticed you have a little bit of a body odor, or maybe you've got a rash in a private area like the genitals and you're wondering, is this infectious? How did I get it? Am I going to spread it to someone? So do not fear. We're covering all these tough questions, plus things like how do you get rid of toe fungus? And what about that tattoo you got at spring break when you were 18 and now you're 34 and you're thinking, I don't know if I want this anymore. So today we are going to be covering all these topics that you may be a little embarrassed about to bring up with your dermatologist, but fear not. That is why we are here. And Dr. Trotter is going to beautifully explain to us what you can do about these things and how you can prevent them and treat them. So you definitely want to check out this episode. If you've ever had a skin concern that you're maybe a little bit embarrassed about, don't be sure to check this episode out. Dr. Trotter is a bread and butter dermatologist. She practices in Ohio, and she also does a lot of patient advocacy work. So it is definitely going to be a great episode. I learned a ton. Be sure to check it out. Dr. Trotter, I'm so excited to have you on. When we were going back and forth about being on each other's podcast, and you came up with this idea about talking about questions that our patients may be embarrassed to ask us about, I just thought it was genius because these questions are out there. I mean, I'm a derm surgeon. I mostly do procedural dermatology, but I am still asked these questions. And guess what? Not even always by just patients, right? Like I'll be asked this at a party or at the playground. So I think it's a great, brilliant idea. And I'm so excited to be talking about some of these embarrassing questions you may be afraid to ask your dermatologist. So thank you so much for joining us.
Of course. Happy to be here. Like I said, I try to hopefully create an environment for patients and for your listeners. Nothing is off the table. We want people to come to us with these questions.
I find even my staff will be a little bit timid or embarrassed to ask me these things. And I'm like, that's why we're here. And yeah, I get why some of these can be embarrassing, but I mean, this is what your dermatologist is here for. So can you just briefly, I introduced you earlier, but I'd love for the audience to hear your own words, who you are and what you do, and a little bit about yourself.
Sure. My name is Dr. Shannon Trotter. I am a board-certified dermatologist that specializes in general dermatology. I also do some cosmetic dermatology and regular surgery, not Mohs surgery, of dermatologic skin cancers and benign lesions. I work in the Columbus, Ohio area, but actually on the outskirts in Springfield, Ohio, over on the west side and on the east side in Canal Winchester. So see a wide array of patients. I work with docs dermatology, and I myself am venturing into the podcast arena. I have a podcast called Derm Trotter. Don't swear about skincare, because I think a lot of us are to that point where we want to pull our hair out about what's truth, what's fiction, and what do we do when we go into a store, and how do we handle just all the different types of things that are skin. So that's kind of a little background on me and sort of why I've entered this space, and it's a great honor to be here with you today.
Gosh, well, I'm so glad you're doing what you're doing and starting the podcast. Many congratulations on that. And we'll share all that at the end and in the show notes. But let's just jump right in. There's so many questions that patients may be embarrassed to ask us, but we're just going to highlight the top ones and we'll have you back for a part two. But let's just start off with patient comes in and says, I have an odor in my private area down there. What do I do? So how do you approach something like this?
Well, I reassure them, whether it's a man or a woman, I tell them, this is totally normal. Lots of people have odor down in the private area or in the genitals, and it's not unusual. A lot of people say, well, I've seen all this news and the craze all about, whole body deodorants and that this is the trend to solve the problem. And I tell them, yes, it can be a potential solution, but just keep in mind it's totally normal. Why you get odor in that area is for a couple of reasons. One, the bacteria and other what I call freeloaders on the skin that live in that area. You can have bacteria, yeast, viruses, and then two, kind of that moist environment that's also complicated by sweat. And often body odor comes from that combination. When bacteria or those other organisms that live on the body come in contact with sweat, you can get that odor that is created. And definitely in the area down there, especially for women, we have a lot of things that coexist in that vaginal skin area, especially on that wet or mucosal skin. And that odor can be different for everyone. Some people, it's not very strong. Others, it might be sort of weak. And then, yes, some people, definitely can have a very strong odor that can be made worse, especially in the era I tell people the yoga pants, the working out, if you're in a hot, humid climate, it's all the perfect mix to get an odor there. And men also struggle with it as well. That's something that's not just exclusive to women, even though I feel like more women are willing to ask about it. And I have to be thankful for the whole body deodorants because now it's more mainstream to ask. Once somebody comes in, and they say, hey, I've got this problem, I really don't know what to do about it. I tell them there are solutions to kind of help with that. One, you do want to make sure that that odor isn't linked to something else going on in that area that needs to be treated directly. Is there an infection in the vaginal skin? Is there actually infection internally, more like a yeast infection or a sexually transmitted disease we don't look at? Of course, you eliminate that. But then just in of itself, if it's just odor that's there are ways to address it. Using those whole body deodorant products can be very helpful. Again, you don't have to, but they can help neutralize that. Some of them will actually create a new fragrance that you might feel is a little bit more palatable than your natural fragrance. Some just completely neutralize it and give no fragrance or kind of odor at all. And they do this with different things. They tend to have more natural ingredients in them, like coconut oil, tea tree oil. Some of them will just have something as basic as sodium bicarbonate or cornstarch. And then also you'll see things that like mandelic acid and other ingredients that are made to create a better scent. And it can last longer than just cleansing the area. That is important to do as a baseline. But we all know even after we cleanse that area, over time, those odors can return. So this is sort of a nice solution. But I always tell people, you got to keep in mind, if you are using a whole body deodorant, a couple things to consider. One, you do want to make sure that you don't get irritated from it or you're not allergic to it. So I always tell people, do a test area. Take a little bit of it, rub it maybe on the inner thigh, that little area behind your ear. Wait a few days, see if you react. Do you get some itchiness, redness, scaliness? And if you do, that may not be the right product for you. If you do okay, then it's probably one that you could try and see if it actually works. And then you can apply it in the areas where you tend to have that odor or tend to sweat. So that can be in body fold areas, which are most common, your armpits. Some people even like the neck folds, the wrist folds, inner thighs, under the breasts, which is huge for a lot of women as well. And then you can put it on the skin, outside of the vaginal area and even around kind of the opening, to the rectum, or what we call the anus, where a lot of people are afraid of odors there too because of bowel movements and stool. You just don't want to put those whole body deodorants inside the body. They are not meant for that. So that's probably the big cautionary tale. But other than that, they are very safe to use. They can give you that self-confidence that kind of wears down over the day if you are concerned about odor in those areas. And like I said, you are not alone. And this is very common. And I have to give, big props and credence to the makers and developers of these whole body deodorants because they've really made this more of a mainstream issue. And I think in particular, women have really hid for this from years and sort of been made to be embarrassed or ashamed, that this is a problem where it's really a natural thing that does occur where you can have some odor in those areas. And of course, we eliminate anything worrisome as well, like I mentioned, if there were an infection. But odor can just be a natural piece of the body.
And I love how you mentioned doing the test spot because you have to be careful with some of these products that have a lot of fragrances in them, even if they're marketed as unscented, right? Like unscented still can have fragrances. And certainly things like lavender, right? Like lavender's everywhere. This can be a sensitizer. So, and also we're putting this in areas where there tends to be a lot of skin on skin contact, which can make it even more potent. So I love that you mentioned doing a test spot first, because you do not want to rub this all over your body and in sensitive areas. And then you break out in a rash. Like that is not going to be fun at all. So yes, do a test spot for sure. And again, I would steer clear of the more like fragrances like lavender and things like that, because again, our bodies are not meant to smell like that. But if you want to try to just neutralize it, then yes, I understand. Now, what about doing things like maybe like an antifungal topical powder or doing things like a benzoyl peroxide wash? Do you ever recommend that?
I do. So that bacteria component, if you're going after it, the whole body deodorants, some of those components are antimicrobial, meaning they kill some of those normal things that live on the skin, bacteria and yeast. But adding in washes can be helpful too. So using an antibacterial wash, maybe just in the areas where you tend to carry that odor. Maybe you just do it in the inner thighs or just in the armpit as a part of your regular shower routine can be very helpful. You can also use benzoyl peroxide. We've loved it for years for acne, but it has great components to it too that go after the bacteria on our skin. It can cut it down. It can be a little drying. So I just recommend for some patients, if you're using it, make sure you don't use it too often because some people it's too irritating and will dry out the skin even more. And so maybe it's better during the summer months or during those hot, humid months. And in the cooler weather months, use maybe a moisturizing antibacterial bar soap. There's one from Cetaphil that I love. So I have a lot of patients that'll utilize that. But washes are great because they also add in to getting rid of that bacteria and kind of just calming it down. The antifungal powders can be helpful too. Some people don't like that cakiness of the powder because of the moisture buildup or perspiration. So we talked about, kind of neutralizing odor, which is what deodorants obviously focus on. But the other piece I told you was the component, I mentioned it's sort of a two hit here. You have the bacteria and other things on the skin plus the sweat part. Deodorants really are going after, that odor part, but something has to go after that sweat part too. And so that's where you have antiperspirants come into play. Now, some of these whole body deodorants have antiperspirants in them. Antiperspirants basically mean they're against perspiration. They try to reduce the sweat that you're producing. Now, a lot of these tend to be aluminum based, and so they actually work on calming those sweat glands down. And if you eliminate some of that sweat, that also helps in turn to reduce the odor as well.
Yeah, exactly. If you can kind of eliminate that sweat, then you will have less odor as well for the sweat and the bacteria to interact. What about things like Botox or neurotoxins in the area?
Exactly. So, we talked about sweating. I mean, all of us sweat. Probably all of us believe we sweat too much. I'm a big fan of thinking I sweat too much. But for some of our patients, they truly have a condition called hyperhidrosis, where they have excessive sweating. It's a medical condition, really affects quality of life. Commonly affects the armpits, the palms, the soles. But some people, it's more diffuse. They can have it over the head and neck or all over the body. Sweating is normal. It helps us release heat, the body to cool down. But when it's in excess, and you have that medical condition, there are useful things to kind of go after that sweat. There are things that you can actually apply to the skin, like aluminum chloride products to reduce sweating. You could even go after medications. You go after that sweat with medications that are what we call anticholinergic, where they calm down those sweat glands. Downside is they can have a little bit of downside of dry mouth or dry eye. And for some people, affect their ability to pee or urinate or even have bowel movements. So there can be some side effects to look out for. They come in towelettes or wipes, but you can even do them in pill forms. And then in addition to that, as you mentioned, Botox. Botox has definitely been, kind of a game changer for some of our patients that suffer with excessive sweating, where you can inject this into the skin and basically it's paralyzing those sweat glands where they can't function like normal. And it's a great way to reduce sweat in those locations. Not everyone's a good candidate for it. So I tell everyone, don't rush in and say you definitely need this. But there are some patients that this is their best option to reduce that sweat production, which can help with odor and definitely self-confidence. If you think about it, I had a patient, he was a CEO of a company, and this is back in the day where people would shake hands on a regular basis. Post-COVID, we've gotten away from that a little, but he would always have a handkerchief in his pocket to keep that hand where he could wipe it before offering his hand to a client or to make a business deal happen. And so we don't underestimate, just how something like sweating can seem so simple, but really be devastating when it's an overdrive for patients.
All great points. And also you had briefly mentioned too, like the yoga pants. Think about what you're wearing. If you're constantly wearing tight-fitting clothing, you're sweating, you're not showering immediately. These are all simple things to do, like make sure maybe wear more loose-fitting clothes. Make sure to shower after working out, to even just get the water to run over your body to remove that sweat and bacteria that's building up. Those are all things to do as well. And just know, like, certain parts of our bodies do have some odor variability, and it is natural to a certain degree. I think sometimes we feel like our bodies need to smell like roses and tulips, and that's just like unrealistic. But really great tips. I love this. Since we're talking about sort of the private parts, let's also ask about someone comes in and says, I have a rash down there. is it contagious? And I actually just had a gentleman come in about this, and he was so worried that it was a sexually transmitted disease and contagious. So how do you approach this?
Yeah, I think it's just totally normal. It's where our mind goes. You get a rash that affects the genitals, the groin area, and automatically, you assume, and your family and friends, if you tell anyone, assume you must have like a sexually transmitted infection. And the reality is, we see a lot of rashes that are not sexually transmitted or even contagious that happen in that area. I like to tell patients that skin, like anywhere else, it definitely has a different context because that is, obviously an area that we tend to be a bit more bashful about to want to show someone. But we do see rashes, especially common things that probably most of your listeners either might have themselves or know someone that may actually have. Something as simple as, well known as psoriasis. I think that's one thing, that's a rash feels like, oh, you can get psoriasis in the genital area. And it's actually more common than what people appreciate. And it can be difficult to treat. Psoriasis is basically a rash where the immune system in the skin is working in overdrive, and it's creating new skin cells at a much quicker rate than we'd like to see. And it's creating scaling and itching, and it can make the area very uncomfortable. A lot of people have seen psoriasis, knees and elbows. They're like, oh, I know what that looks like dry, really flaky, red skin. But often when it presents in the genital area, it may look totally different. It could be smooth and shiny and more moist and soft just because of the environment and that location. But nonetheless, it can still be very uncomfortable. It can be painful, itchy, and it can be difficult to do normal things like just sitting, crossing your legs, exercise, or walking. And even affects you, if you think about it, sexual intimacy for a lot of people. So it has a tremendous impact on quality of life. The good news is for something like psoriasis, we have great treatments available now to actually treat and put psoriasis in remission. There are particular medicines that are focusing on the genital area skin too, because it can be more challenging to treat. So there's good news on the horizon to actually address that. So I tell patients, that is something you might know of, but never thought it could happen down there. Similarly is also eczema. What, I think a lot of people know, like, yeah, I've had eczema since I was a baby, or yeah, my best friends had it. They get that dry, rashy, itchy skin, but, it's kind of here on the creases of their elbows or behind their knees, or they might have a little bit on their legs at one point, or it gets worse in the winter, but it also can affect that genital skin. And again, in eczema, the immune system again in the skin, not living in harmony. It's kind of an overdrive again, making all the redness you may see, the dryness, the itchiness. So again, we tell patients, this is something that can be treated. We have great medications available. So don't just assume, that it's something else. It might actually be a more common rash that you just don't think of in those areas. Now, less commonly, there are some other things that people may not have even heard of or even know that they've got that like to affect, genital skin or that inner thigh area. One of them is called hidradenitis suppurativa. I think a lot of people have this, but just don't know it. They're actually walking around with it. They don't talk about it because of how it behaves. Hidradenitis suppurativa is, or HS as some people call it, it's also caused by the immune system not working the way it should be in the skin. And what happens is patients present with these large, painful, boil-like lesions. They can ooze fluid. They can actually develop little tunnels under the skin and drain. It can result in scarring as well, and it can be quite painful. And not only does it affect kind of the inner thigh area, you might see it on vaginal skin, or for men can affect part of the scrotum or even back toward the anal area for both men and women, but it loves any body fold. So that can be as simple as just the fold behind the neck, or, it could be the armpit area.
Under the breast.
Yeah, under the breast, exactly. All these fold areas. But some people just have it more predominant, I think, in the genital area. So that's not even on their radar. Just oh, I just get boils. It's no big deal. But I've seen patients, again, they can't walk. They can't function. 15-year-old girl, she couldn't play sports, simply because of it. They can have an odor associated, like we've talked about earlier, that can be associated with these lesions. So I really highlight this because it's now getting attention as a disease in dermatology, where we have drugs that are being dedicated to it. We've been fortunate to participate in clinical trials for it. We have some that are upcoming. So it's really been a passion of ours to find a treatment for this so you don't have to live with spots like that. And I'm willing to bet some of your listeners may know somebody walking around with spots like that, or they themselves have it, but really haven't sought medical treatment. They just sort of dealt with it. So I really hope with being aware that people aren't embarrassed and say, that could be me. Maybe I need to see Dr. Mina or a colleague of hers to really address this more thoroughly and find out what's going on.
I find HS is one of those that affects especially young women, and it can be very stigmatizing. And you have these weeping areas and they just think, oh, of course I'm infected or I'm dirty. That's why I have these infections here. But really it's inflammatory. But I bet, I mean, you're totally right. I think it's way underdiagnosed simply because they think it's because they're dirty, they're not cleaning. And if anything, they're over cleaning and they're just embarrassed to seek treatment because they think it's something that they did. So I love that you brought that up.
Yeah. And then lastly, probably, we were talking about these rashes. We always think of things contagious in the groin area, whether sexually transmitted infection or just classic jock itch. We were talking about, as you mentioned, these inflammatory rashes, psoriasis, eczema, hidradenitis suppurativa. And then the last one I was going to mention is something called lichen sclerosus. This is something I think that gets missed, especially more so, I'd say, in women. It is more common in women, but they might just present with itching and kind of just deal with it. They may not see anything on the skin because it tends to affect that wet or mucosal skin more inside the vaginal area, might track around to, again, involve the area around the rectum or the anal area. So they might not even know it's there. They just have itch and they just deal with it. But this is a very, I think relatively common thing that we tend to see because we do a lot of vaginal exams for skin exams and catch it sort of inadvertently because people say, yeah, I've been itching a lot or I've been burning. Now for men, when it presents, they can actually typically see something. So they will see something that might affect like the glands of the penis. And they're like, wait, this doesn't look right. The skin, regardless in either area, can look kind of white or shiny. It might look, a little what we call atrophic, where it's kind of lost its kind of fullness, if you will. And then what's important too is some patients will come in, especially women and men to a degree, they might report it's getting more difficult to urinate. Like it's hard if it's affecting kind of that opening where we all urinate from, what we call the urethral opening. And then sometimes too, people report constipation if it's affecting that area around the rectum. Or for women in particular, they might report, pain with sex or intercourse because they might have some tightening of that vaginal opening. Now, we usually see it in women postmenopausally, but then we sometimes see it in little girls before puberty. And so it can be something that gets missed or it's just not on the radar or people are worried. In young girls, sometimes sexual abuse comes up. They're thinking something like that's happening. They're not even thinking about a primary skin rash. And for women later on, sometimes it's just on the radar. They're like, oh, I just thought it was itching, but it can be intense. And so it's important to have an exam to look at that skin and diagnose it, especially long term. We do worry about the development of squamous cell carcinoma in that skin. A type of skin cancer, people think mostly like, oh, I thought that happens on my head and neck because I get too much sun. But that type of skin cancer can also happen where inflammation is just constant. And so those patients need to be evaluated and screened for that type of skin cancer, in addition to simply just treating it because of how it affects their quality of life. Again, when we have things in the genital area for men or women, it's very sensitive. It can be embarrassing or shameful, and it shouldn't be. We definitely want to treat it because we know we can have an impact for them to affect, their ability to move, to walk, to exercise, sexual intimacy. All the things are important for quality of life.
Totally agree. And a lot of times it can just simply be what we call intertrigo. And I think the easiest way, if you have ever changed a baby's diaper or had a baby yourself, right? They get those red rashes and their skin folds, right? And it can be a diaper rash, essentially, right? It's just from that moist skin, some irritation. There could be some yeast and some bacteria in there as well. And it can be as simple and common as that, but we definitely don't want to miss these inflammatory skin conditions. And then also, just because I do see more cancers, there are cancers that can happen in this area. The squamous cells, like you mentioned, but we can also see things like Paget's disease. And then we can see more rare things like something called mycosis fungoides can present as a rash in the groin area as well. So don't be embarrassed. Don't be shy. Sometimes people wonder too, like, well, is this really something I should show my GYN or maybe a urologist, or should I show my derm? And I would say, show your derm, show your PCP. If you have a GYN, they can look as well. And sometimes we all get together and share and discuss as well. If I feel like it's more of a GYN concern, I'll reach out to your GYN and vice versa. So I think the main message here is just don't be embarrassed. Don't be shy. We have skin in this area. It is part of what dermatologists evaluate and treat, and we'll let you know if it's something that needs another specialist.
Totally. The only thing I would add to that is, what you mentioned, like, that irritation factor, like you see in babies, that can also happen. I tell my patients they're embarrassed. They might have incontinence where they can't get to the restroom in time and they develop essentially, like a diaper rash picture as an adult. And I tell them, no, this is common. And we call it irritant dermatitis. It's super common. There are ways for us to treat it and help you through that because it is something that happens. And then lastly, allergic contact dermatitis, people are putting a lot of different things. We just talked about putting whole body deodorant down there. So we do put things in that area. I'm astonished sometimes what people might try to help with, maybe the rash started and then they're adding things to help it that actually are making it worse. Or secondarily, they've tried things just to treat that area to see what happens, and they've developed potentially an allergy. And that can be, from things, cleansers in that area that people use. You can see it in certain dyes or fabrics, the close contact of your underwear. It can be related, yes, to detergents or fabric softeners. And then, also I tell patients, even things you don't think about, like, liners in a panty liner or fragrances that are in tampons or other personal hygiene products. Just keep in mind, those types of things, that skin is delicate and sensitive. So you can develop an allergic contact dermatitis or even an irritant contact dermatitis. And sometimes they're both there more often than not. And so don't be embarrassed. Like you said, I tell people, tell as many people as you're willing to, because if there's some doctor you trust, even if it's not your dermatologist initially, they will get you to the right place because that skin deserves as much attention as anywhere else.
Well, so let's move away from the genitals and let's pivot here and let's talk about tattoos, right? It seems like everyone has tattoos. Like, it is no longer taboo. In fact, I joke that like now it's going to be like the sign of rebellion when you don't get a tattoo. But so say someone has a tattoo and they regret getting their boyfriend's name tattooed on their arm. Like, what can you do? Is all lost, or are there things we can do?
Well, fortunately, not all is lost. I know they say tattoos are forever, but we do have some options. And, I just had a patient come in actually a couple weeks ago, and she said, and pointed to her arm, she said, I refer to this as my spring break mistake. And I said, I like that. I'm going to use that. Because I think sometimes that's where some people, get a tattoo. It's sort of spur of the moment or spontaneous, or, there's something momentous going on in life, or the love of your life that happens not to be the true love of your life in the end, and you wind up with something on your skin. You think, oh my gosh, this is permanent. What am I going to do? Well, the whole concept of tattooing, where they're putting these inks into the skin, they're really shooting down for that second layer, what we call the dermis. And when they get the particles there, they're pretty big. So a lot of people always wonder, like, why doesn't my body react to a tattoo? Now, sometimes people do react, and they can have certain rashes or responses to tattoo ink or pigment because it's foreign. But in general, because it's pretty big, the body will kind of leave it be. It's an injury where it heals up, and then that's the tattoo that you're sort of stuck with. Now, if you change your mind and say, okay, what can I do? And you go to your dermatologist, there are a handful of options that can be reviewed as potential choices for you to pursue. Probably the most common, and most people argue probably the most, effective, is laser surgery or laser therapy. And basic concept behind here, we talked about those tattoo pigments being pretty big, is that a laser will basically sort of knock them down. The laser is attracted to the pigment of the tattoo in your skin, breaks it apart into little particles, and then here's the immune system again. It comes into the skin and tries to eat up that pigment or take it away. That's kind of the basic concept behind which it works. The downside with laser treatments is you might need multiple treatments. They can be a little more expensive, than some of the other options, but they do tend to be most effective. And if you look at these laser devices, what's important to highlight is they are FDA approved, typically for tattoo removal or lightening. And I know it's important because some of the other treatments we will talk about are not really FDA approved, and there's some debate about their usefulness for patients and safety. So in essence, when you get that done, it's targeting tattoo pigment. Keep in mind, for certain pigments, it's a little easier to get them gone. So usually for like blacks and blues, they tend to be easier to get gone than like your reds or yellows. And so that can be where there's a little more time investment in it, and then potentially also cost, again, and then multiple treatments to get the desired effect. And the downside too is you could still get left with some potential for scarring or pigmentation change that doesn't match your natural tone. So it's important too, you go to somebody who does tattoo removal on a regular basis, so they're familiar with the different types of lasers that are out there. And the technology has come a long way compared to those 10 years ago, and you're probably looking to get rid of a tattoo. Definitely that technology has improved. And so with that improvement and going to an expert that looks at your skin and understands your skin type, whether you're lighter or more fair skin or you have darker skin, and then looking at your tattoo in and of itself, they can pick the right treatment regimen for you based on the laser that would be most appropriate to just give you the best outcome.
Well, speaking of tattoo removal about 10 years ago, I have some personal experience with that. When I was 18, I decided to get a tattoo on my lower back, and I loved it for about a year. And then people started referring to that as a tramp stamp. And I was like, oh no, this has got to go. But it was cost prohibitive for me to remove it. I mean, it was too expensive. And so I was like, I have to live with it. But once I became a derm resident, we played around with it and it is now gone. But I will say, and I'm someone with very light skin, there are some what we call hypopigmentation. Like if you look closely, you can see it. So even though we can, all that blue-black ink is removed, you can still see the faint residual areas where it used to be. So it's pretty good. And granted, that was over 10 years ago. But yeah, like really, it's hard to remove it without any sign or indication that it was there. So just keep that in mind before you get a tattoo. Now, I don't know if you're going to talk about this, but I've had some people, especially if they're going into the military or they have smaller tattoos, they need their tattoo off like immediately. And I've cut them out. So if they are small enough, sometimes it's more cost effective and certainly time effective to just cut it out. And a lot of times that scar can hide very nicely as well. So that's an option, not always an option, of course. But what are some newer treatment modalities for tattoo removal?
Yeah, so surgery, like you mentioned, is definitely done for those smaller lesions, can be challenging with it. And then some patients have definitely tried dermabrasion. And so this is something that there's some debate again about how effective it can be, but basically using a diamond wand or a brush device where basically I tell you, just think about like sanding away those layers of skin to try to get to where the tattoo pigment lives. So basically you kind of sand it down all the way to that level. The downside is, again, you may need more than one treatment. It can be pretty uncomfortable, pretty painful. You do have a risk of infection, and often the treatment can be incomplete where you don't really see much treatment at the end. And the scarring can be more significant depending upon the patient. Also, pigmentation changes. So not always a great choice too if somebody tends to hyperpigment or they might hypopigment, because once you get down to that level, you're really destroying those pigment cells. So often that skin is not going to have a normal appearance, once it gets back up to the surface when you kind of look at it.
I don't love that option, honestly.
I tend to tell people don't do it. It's typically not going to be successful. It's sort of an older treatment, I feel like, too, that some people have revisited recently if you look at some of the conversations. And along with that, some of them have done, you've probably seen that salivation as well, where they're using salt and sodium chloride and gauze, saturating it, trying to rough up the skin and rub it down to the basics. And then they're rubbing salt into it and then literally trying to do this. And this is, if you go online, this is why I like to bring it up, because people are talking about this as a home remedy treatment, just to make your listeners aware. This is not something we would typically recommend at all. Again, you can just think how painful when people talk about rubbing salt into your wounds. This is literally what you're doing to try to accomplish getting a tattoo gone in that area.
And I can just see the scar being horrible, kind of hypertrophic, thickened, pigmentary changes. Yeah, I would not recommend.
No, it's just something to make people aware because they'll read about it. If you Google tattoo removal, I'm impressed, I guess, sadly so, at how high it comes up as a treatment option, including also, chemical peels. Some people will choose chemical peels to get tattoos gone. They may use trichloroacetic acid, or what we call TCA, or other things that may peel the skin down, again, to try to repeatedly lighten it and destroy that pigment. Again, can be very tedious, very difficult to do, often don't get great results. Scarring and healing, overall cosmetic outcome are not very good for that as well. And I did want to mention too, the creams that are going around that are approved, that people think are approved for tattoo removal. There are no such FDA approved creams for tattoo removal. So that's one of the things I like, because I have patients come in like, well, what about this cream? And they will bring in a cream that they found online and they'll say, take your tattoo away or phase your tattoo out. Now, often they contain ingredients, things that you and I have talked about that we love, like retinol that we use a lot for anti-aging, or they may have leaching or lightening creams, built into them. But again, we don't tend to see very good results. They are not FDA approved. And then also we tend to see a lot of irritation. Again, contact dermatitis we just talked about, we'll see people get, peeling or a chemical burn from it, or they may even be allergic to one of the components that are put in there. So another treatment, just to let you know, that gets listed, but typically that we don't tend to recommend.
So I do Mohs surgery. So I'm looking at people's skin under the microscope, and I will at times be treating a skin cancer within a tattoo. And so I get to actually see the tattoo pigment under the microscope, which looks really, really cool. But it is deep in there. It is deep down into the dermis. It's deep enough, typically, especially these professional tattoos, right? Because they want the ink to stay there. It's so far down, it's to the beyond the level of where you're going to get scarring. So all of these topical things, they are not going to be effective. You are just going to irritate your skin, cause scarring, and you're still going to have that tattoo in there. So yeah, not recommended. Really, I would say laser is the way to go. Laser can work wonders, but it does take time and it is costly, and an excision if it's small enough.
I would agree wholeheartedly.
Any other treatments for tattoos I'm just not aware of?
Those are the big ones. I think they're looking at different, laser technology, improving upon what we already have. But no, those are really the top things that get listed. And again, the focus is really on the benefit of lasers being the most efficacious, the treatment that works the best and most safe to a degree as well, as safe as if you will, just because, again, administered by a healthcare professional, typically a dermatologist who's an expert in tattoo removal.
Yeah, although they're not always, right? Like you get these tattoo clinics popping up all over. And I would say if you're someone who has my skin type with a traditional blue-black tattoo, you're probably going to be fine. But if you have a tattoo with more yellows and reds and oranges, those are going to be trickier colors to remove, or white. And then also if you have darker skin, you need to be more careful. You really should see someone who has extensive laser training so that you don't damage your skin. So just a little word of caution there, because I do see these tattoo places popping up all over and it's not going to be the right choice for everyone. So love that you mentioned that. All right, well, let's take it home with a favorite frenemy of everyone's. It seems ubiquitous, right? Toenail fungus. It seems like once you hit a certain age, everyone's got it, right? So what can we do about toenail fungus?
Well, the first thing that I tell patients is one, is it toenail fungus, which we're going to talk about in a moment. But I like to highlight that I think, a lot of people, I was talking with some of my staff and they're like, well, how's that embarrassing? And I said, it is. People don't want to ask you. Just 2 weeks ago, I had a gentleman come in and he asked my staff member to leave the room. And I thought, oh no, maybe he's upset about a patient experience. Yeah. And then I thought, well, maybe he has a lesion in the genital area because often people want some privacy, which I totally understand. So I said, sure, no problem. She stepped out. And as I was just turning around because I was shutting the door, he was already taking his shoes and socks off. And he looked at me and he said, can you get rid of this, please? And you could just see the look on his face. One, he felt embarrassed to even ask in front of my staff person. Then two, I think, the reason we do treat it is the impact it has for people on quality of life. Their perception of how their nails look, that people will think that they're not clean, that they don't have good hygiene, that there's something wrong with them. So I think I just like to highlight, it is important to treat because I do think some people are like, it's just cosmetic. But I think you have to understand for some patients, cosmetic is very important still to their self-esteem and confidence and how they live each day. But kind of going back to one, is it toenail fungus? I think that's the question that we have to ask. So, when the nail, whether it's a fingernail, toenail, doesn't look right, we'll call it, a nail dystrophy, in dermatology. And I tell my patients, about 50% of nail dystrophies are caused by fungal infections. So they're looking at me like, well, what's the other 50% caused by then? I said, good question, because you may not have toenail fungus and I want to treat you for it if that's not what you got. So I mentioned to them, we talked about psoriasis earlier on, how it can affect skin no matter where that skin is. Well, it can affect the nail and create nail changes that look like fungus. Sometimes you do have psoriasis of the nail and secondarily you get fungus because of those changes. Then there's also a skin condition called lichen planus. I tell you, it's kind of like a cousin, if you will, to psoriasis that can also result in nail changes. Then you can just have trauma to the nail that can happen. You can have growths like warts to the nail, sometimes a skin cancer, other things that people say, ooh, I think I have fungus, or they're taking a medication that might change their nails and they're worried they have fungus. So I always tell patients, first and foremost, let's find out, is it actually fungus? So usually you're going to test it. You take a clipping of the nail, you send it for testing. Once you've confirmed if fungus is there, then that kind of puts you in a treatment measurement of, okay, how are we going to treat this? What's going to be the best, choice for patients? And I think that's where, you'll see lots of different things that have been talked about. Again, anecdotally, I'll have patients that have already come in, they're like, I've already done vinegar soaks and I felt like it was a little helpful, but it hasn't improved. Or they may have come in and they've done, camphor or menthol ointment or what we call Vicks Vapor Rub. And they're like, that's helped me a little, but I'm not there. And I tell them, yes, there are some benefits to some of these over-the-counter measurements. They have antimicrobial effects so they can go after it, but often they're just not enough. And so then we can start looking at, what can we do prescription-wise? There are topical prescriptions that you can put on the nail that can help. The downside with these is you have to treat a long time. I mean, the labels will say up to 48 weeks. And I'll see patients doing the math in their head. They're like, 52 weeks in a year. So you're telling me almost 11 months of my life I'm going to treat this. And I'll tell them yes, and it still may not work. But yes, that is an option. The topicals, can be beneficial if you have, mild case, maybe just a few toenails or fingernails that are involved. And if you're diligent and you can keep with it. But some people, it's still not enough. So then, we're kind of looking at oral treatments, that we can use medications by mouth that go after fungus. And I always tell people, keep in mind, with nail fungus, it could be true fungus, it could be yeast form. There's different types of fungi, so some antifungal medicines are better than others. But for the most part, we tend to use terbinafine most commonly. And again, so if you're treating, though, the downside is you have to do a pretty good duration of treatment, especially for toenails, a minimum of 3 months. Then often we're treating beyond that, or sometimes there's medicines we can pulse where we just give you a little bit each month to try to see if we can clear you. And the reality is it's just, sometimes people get frustrated with the treatment regimen and how long it is. And then the ultimate kicker is you got to wait for the nail to grow out. So you have to see, is what we did actually successful? And, for toenails, they'll say 12 to 18 months. That's a long time, even if you could treat it a course of therapy, just watch and wait and see how those nails do. And I always tell my patients what's frustrating too. I said, not only when we treat you, could we maybe get the fungus gone? That's what we hope for. But sometimes we don't, and you still see nail changes that look like fungus. So, there'll be reports that these medicines give you a mycological cure, which basically means, did we get the fungus gone? And then 2, you might get a complete cure where the fungus is gone and your nail looks normal. That's what everyone wants. But reality is not everyone gets that. You can still get the fungus gone and your nail may still look like there's fungus there. It's almost like scarring is the way I try to explain to my patients. Your nail just looks funky, and unfortunately we'll reclip or retest, it's negative, but we don't get that nail perfectly normal again, which is frustrating.
Gosh, this sounds like all bad news. Give me some good news.
I'm going to end with some promising. A little bit of bad news first. About 25% relapse rate is the way to think about it for toenail fungus. So that's the challenge. But there are things, good news, that are on the horizon. They are looking at laser photodynamic therapy, which is showing some promising results of clearance. And the dilemma with this, though, is more studies are definitely needed to show the efficacy and safety of it. But they are showing, an option for patients that can't tolerate the oral medicines. Some people, the oral medicines have drug interactions, so they're not a safe bet. Or yes, we do monitor liver function. For terbinafine, only testing prior is recommended from the FDA, but some people test throughout because they're on other drugs that affect the liver. So that's probably where we're headed. That might be the future of how we treat toenail fungus. The other positive is that there are things you can do for prevention. When we see toenail fungus, we know it's more common as we get older. People have poor circulation, diabetes. There probably is a genetic predisposition, we think, where some people just don't clear the fungus well. But to prevent, we recommend trimming the nails short, keeping the feet clean, disinfecting shoes, socks, not walking around in public spaces, barefoot as well. And if you happen to get athlete's foot or where you get a fungal rash of the actual feet, treating that can be helpful. And then after you've gone through a course of therapy, often topicals can be brought back in for prevention as well to try to prevent those relapses. But yes, I tell people, unfortunately, when you look at, toenail fungus, some of the negatives outweigh some of the positives. It is something we definitely still struggle to treat in dermatology, but we don't underestimate how important it is to address it for our patients.
There are definitely things to try, right? I love that you have to be realistic, and you've got to share this with the patients too. You're not going to take this pill and it's a magic cure-all and you're going to have beautiful, normal-looking toenails. Like, I wish that were the case, but not always. And I love that you mentioned, we can get a mycological cure, but your nail still doesn't look great. And then if you are still walking around in public places, you're wearing sweaty socks and shoes, even if you do get that clearance and cure, it can come right back because these funguses, they're everywhere, and the yeast, it's everywhere. Now, this is maybe a little unconventional, but sometimes if someone just has one abnormal toenail, I will take it off. And, of course, I'm not going to take all 10 off or 5 even. But sometimes if it's just 1 or 2 that's troublesome or bothersome, then taking the nail off can allow it to grow back. And I'll usually also have them use some topicals at that point to really try to prevent it from coming back. But yeah, certainly I'm glad you mentioned the Vicks Vapor Rub and vinegar soaks because people do talk about this. And for some people, it can work, but it's not, again, a cure-all for everyone.
Yeah, it's something we still struggle. I tell you, in this day and age, you think about technology. we could be toenail fungus. And ITs, they said, it has outsmarted us yet to this day to a degree. So I told you, not to be, totally cynical about it or pessimistic. We're going to try, but there are some limitations in what we can do. But hopefully in the future, we'll get much better at it.
It's kind of crazy to think we have self-driving cars. We have been to the moon and we cannot fight and cure toenail fungus. Wow. But I also am glad you mentioned making sure it's toenail fungus because, again, I do a lot of skin cancer surgery. I had a gentleman who was treated for a toenail fungus for 2 years, and it was a squamous cell carcinoma. And so getting a diagnosis, especially if it's not behaving like we think it should, not getting better, no difference, it's important to get that tissue, get a clipping, figure out if we really are dealing with a toenail fungus because there are some mimickers as well. So I'm glad you really brought that up. And don't be embarrassed. Again, dermatologists, we treat skin all over the body. We also treat hairs and nails. And so this fits under nails for sure. Well, Dr. Trotter, I'm definitely going to have you back on because we have so many other embarrassing for patients things to talk about that I don't want people to be embarrassed about. I want them to know that this is normal and you're not alone. So we'll have to have you back on. But I know our listeners are going to want to follow you. They're going to want to check out your podcast. So please share all of that with our audience.
Thank you so much. Yes, you can check us out online at www.dermattrotter.com. You can also follow us at Trotter with all of our regular streaming podcast sites if you're interested there, and also on Facebook and Instagram at Dermat Trotter.
I love it. Well, I will include all of that in the show notes. Be sure to check out this amazing new podcast. You will get so much value from it. And thank you so much for being here, and I will see you next week.